Hello everyone, welcome to my YouTube channel Dr.MZ. I am your OET instructor here, and in this video we'll go through a quick review about when is OET required, who can give this test, and how is this conducted. We also have a demo test in this video, so let's begin. What is OET basically? It's an English language test especially designated for the healthcare sector. That means only the healthcare professions can sit in this test because it's profession specific. That means it's only going to require the medical information regarding the doctor patient or the nurse or the dentist, whatever the profession is. It's only regarding that specific profession only. And people who need to work abroad, who need their work visa or want to register themselves in an international country, they all need to sit in the OET or any English language exam. And mostly health professions choose this OET because it is their occupation specific. So it is also used to book any international exams, mostly the PLAB exam, the EMC, the USMLE, etc. OET is specified for 12 professions in the healthcare sector. It could be for a dentist, a nutritionist, a doctor. Doctors are going to choose medicine as their subject when they want to sit in the OET. The nurses and the occupational therapist, the optometrist, a pharmacist, a physiotherapist, a podiatrist, a radiologist, a speech pathologist, and a veterinarian. These all 12 professions can sit in the OET exam, and they are supposed to choose their occupation to sit in the specific OET exam, and they're going to be giving the entire exam only their occupation specific. It's not going to be only regarding the medical information, it's going to be regarding their specialty of it. OET consists of 4 components like any other English exam. It has a listening component, a reading part, a writing part, and a speaking part, and we're going to discuss each and every part one by one. The test you're going to give in the OET exam is the listening subtest. The time allotted for this subtest is 40 minutes, and you can see the score. It has parts A, B, and C, and each has a different score for it. The part A is comprised of 24 marks, the part B is for 6 marks, and the part C is for 12 marks. So the total is going to be 42 marks, and you're going to score accordingly about whatever grade you want. It could be grade B, could be grade C, whichever you want for the specific professions, and you need to score accordingly for that. I'm going to explain the score distribution in my next video, so don't forget to watch that as well. So in part A, you're going to have 2 recordings. It's going to be a conversation between a doctor and a patient. You need to fill in the blanks over there. Please keep this in mind that in part A, you need to have your most concentration. You need to have your attention 100% over here, because the entire part A is not just the fill in the blanks, but it has the most weightage in the scores as well. It is of 24 marks. That is the highest in the all 3 parts in the listening. So you need to be most attentive when you're doing your part A and the listening. The next part is part B, where there are 6 recording extracts, and for each recording there's going to be a different MCQ. It's going to be 1 MCQ, 1 recording, 1 MCQ, and 1 recording, and they all are not going to be interrelated. They're going to be different. It can be any conversation again, it can be regarding any team briefings. Any leader of the team would be giving instructions to each and every person in the team, or they're going to be handovers, there are going to be any doctor-patient dialogues, anything like that. Is going to be 6 extracts, and you are supposed to listen to each and every extract. You're going to have some time to read your MCQ and fill in the correct answer. Then in part C, there is a recorded presentation or an interview. There are going to be 2 parts into this, 2 extracts, and are going to be 6 MCQs for each extract. That makes them 12 MCQs and 12 marks for this part as well. If you are going to notice the scoring over here, you need to know that the highest scores are in the part A, so you do not need to make a lot of mistakes in that part. And in part B, there are 6 marks, so that's like the least weightage in the scoring, but still I will suggest you to maintain your concentration throughout your whole listening exam, but do not try to miss out any answers in part A and part C, because that's where you will be needing your most of the marks. Then coming back to reading part. So in the reading portion, it's about 1 hour in the time duration, and the scoring is a little bit different from the reading from the listening one. The part A has 20 marks, the part B has 6 marks again, and the part C has 16 marks. Total is same, that 42 marks, and you're going to be scored from the total marks, and you don't need to go through that in part A. What are you going to score in part B? You are not going to be scoring individually in each and every part, but the score is going to be on total marks. So in part A, you're going to have 4 short text here. It's going to be text A, B, C, and D, and it's going to be labeled on top of each and every text box. I'll show you in the video ahead. And there are going to be 20 questions for all of the 4 text in total. They're going to be matching sentence completion. They're going to be short answer questions, 1-word answer questions, and it's going to be a very quick part A is going to be very short. Please keep this in mind, that in reading section you have only 15 minutes exact to complete your part A, and then the question paper is being taken away from you. So you're not going to have much time in part A, and you're going to use your skimming technique over here. You need to really manage your time and complete it within the 15 minutes. Then comes the part B. In part B, you're going to have 6 short text again, just like in the listening section. You'll have 6 text, and then you're going to have 6 questions. It could be any policy documents, it could be regarding a hospital guideline, or any manuals, any emails, internal communications or something, or it could be even memos as well. There are going to be MCQs, and they're going to have each MCQ is going to have 3 options. You need to select any the best option you think is the right answer from that. And in part C, you have 2 text, and it's going to be lengthy text. One text is going to be for about 2 pages, and there are going to be a lot of paragraphs in that, and there are 8 MCQs in each part. There are going to be 2 texts, so total there are going to be 16 MCQs in part C, and you need to select the appropriate MCQ according to the comprehension, according to the text provided to you. Then coming forward to the writing text, when you're done with your listening, when you're done with your reading in 1 hour and 40 minutes, you're going to have your writing text. It is for 45 minutes. You have 5 minutes reading time, and in 5 minutes reading time, you are not allowed to pick up any stationery from your table. You're not allowed to have any pen, pencil, eraser, sharpener, whatever. You aren't supposed to be empty-handed, and only your question paper is going to be in front of you, and you can only read. That's it. Within those 5 minutes, the instructors are not going to allow you to make any markings on your question paper or any changes using your pen or pencil or any stationery item. You're going to have a very thorough reading in 5 minutes. 5 minutes are good enough to go through your case note, and you'll have an idea about what you are going to write, which type of letter it is, and you can make your plans just in your mind. It's like brainstorming just in your mind. Then after 5 minutes, they will announce that you can now pick up your pencils, and that's when all of your markings are going to be started. You're going to underline your case notes and begin with your letter as per your need. There are going to be 40 minutes for the writing, and there's going to be only 1 letter writing, so you gotta give your best in this 1 writing task. After the writing part, we have the speaking session, which is around 20 minutes. You're going to go into a room where there's going to be a speaker, and they're going to have a short warm-up conversation, which is about your professional background. Why did you choose this profession? What is the best thing about this profession? What do you like? What are your future plans? It could be anything like that, and it is not recorded. It does not has any scores, so you do not need to worry about this part at all. It is not scored. mode. It is only to make you comfortable or make you recognize the accent, the voice, the way your speaker is having a conversation with you, so that you can be comfortable when you're having your role play cards. So basically, in speaking, you have 2 role play cards. They're going to be 5 minutes for each role play. You're going to have a 3 minutes time to read and mark on your role play cards. You're going to have 1 role play card each, and before starting each role play card, you will be given 3 minutes in which you can mark on your role play cards. Yes, you can mark you will be provided a pencil over there, and you can underline, you can circle, you can make question marks or whatever you want on your role play question card. And after the 3 minutes, your time is going to start. Like 5 minutes, you're going to role play your profession. If you're a doctor or you're a nurse, you're going to be the nurse, you're going to be the doctor, and in front of you is going to be your patient. And within 5 minutes, so basically the time should be between 4 minutes to 5 minutes of speaking. If you end before this, it's like you lack any kind of information while speaking, while counseling, while talking to your patient, and that doesn't count really well. So you need to pay attention to the time. There's going to be a watch in front of you, or your speaker is going to inform you that the time is up. So if you have completed in more than 4 minutes, it's good enough. The second, the role play card is going to follow after the first one, and you have a different case in that role play card, but the whole format is going to be the same. We're going to practice the role play card ahead in this video, so let's move forward. Some portions of the OET sample test, so that you may have a more clear idea about how the exam is being conducted and how you're supposed to answer the questions. And let's go through a quick understanding of how the entire test works. And before showing you the worksheet, let me tell you that once the worksheet appears on your screens, a recording is going to be played, and it's going to have the instructions regarding how you're going to listen and how are you going to fill in your questions over there. So you need to grab your paper and pen, and you need to number down 1 to 12 actually on your paper, so that you can quickly answer wherever you listen to the audio recording. And it's going to be a conversation between a doctor and a patient. This worksheet is regarding the medicine, for the medicine people, or for all the doctors, but it's going to be similar, very similar for the nurses as well, and for other health professions as well, so they can have a very quick idea about how this listening test is going to work. So let's begin.
Test. Sample test 1. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1, questions 1 to 12. You hear a physiotherapist talking to a new patient called Ray Sands. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Come in. It's Mr. Sands, isn't it?
That's right, Ray Sands.
Now, I think you've been referred to me because you're suffering from sciatica.
That's right. Not for the first time, actually.
OK, well, I've got some notes here, but perhaps you can tell me in your own words about any previous bouts of sciatica you've had, what treatment you had, what worked for you, anything else you can remember.
Righto. Well, it all started when I hurt my back. About 18 months ago now.
OK.
I was giving somebody a hand with a heavy suitcase and I felt it go, woof, just like that. Anyway, I slowly got over that, despite occasional flare-ups, and then, out the blue, about a year ago, sciatica developed. And it was 6 months till that finally cleared up altogether. Now it's come back in the last month or so, I'd say.
I see. And your GP said it was sciatica?
Yeah, I had this pain all the way down my right leg, and she said the real problem was in my back, because the sciatic nerve was getting trapped.
Right.
I mean, I'm telling you, this was no ordinary pain. It was really intense. I mean, to the extent that I couldn't stand for very long, couldn't walk hardly any distance, I couldn't sleep.
Oh.
I mean, the most frustrating bit for me was that I couldn't even turn over in bed. It just hurt so much. I just couldn't get comfortable. Do you know what I mean? Sometimes I'd have, sort of tingling feeling in my calves as well.
Right.
But then at other times, my whole leg just felt a bit numb, really. It was weird. And of course, I couldn't go to work. I'm an events organiser, so I travel about a lot. I'm setting things up for conferences, lugging stuff around, And so there was no way I could manage any of that, the state I was in.
OK. So how was this treated?
Well, in the first instance, I was given painkillers, obviously. Ibuprofen, as far as I can remember.
Right.
And I was told to put compression packs on the affected area. I mean, that did ease the pain a little, but I was still housebound, practically speaking.
OK.
Then the GP sent me to see an osteopath, and I got some treatment there, but it didn't seem to make much difference.
Right.
So I was referred to a sports injury specialist, of all things. And he did a number of things that did seem to ease things a little, like working on my spine and lower legs. Oh, and he gave me a set of exercises to do at home.
I see. Any other treatment?
I almost forgot. There was this course of injections, and I went for various other therapies, like ultrasound, and another one where they use, electrical impulses. I can't remember exactly what it's called.
OK.
At one point, I even considered acupuncture, but by then, the other things were beginning to take effect, and the symptoms were subsiding, so I gave it a miss.
So, which of these various treatments do you feel was most effective? What made the difference?
Well, I couldn't say for certain, because it all went on for 4 months without much improvement, really. Then it wasn't until, suddenly in the 5th month, things changed quite dramatically. So to be honest with you, I think it was the combination of treatments gradually taking effect and coming together, rather than one single thing making the difference.
OK. And did anyone ever talk to you about what might be causing the problem?
Well, I think everyone assumed that a slipped disc was behind it all, but
Right.
was never actually confirmed as that. I mean, I know there is this other condition where you get a lot of pain in the buttocks, but that wasn't my experience.
OK. And did anyone talk to you about aspects of your lifestyle that might be contributing to the problem?
Well, I remember actually there was...
Hope we all are done with the listening demo test over here, and do share how was your experience when you were listening and when you were trying to figure out what the correct answer is. So I have note down over here the answer sheet, and these are the answers, so go through them quickly and do your markings on your own, that how many correct answers did you got, and let me know in the comment section below that how much did you scored in each and every subtest, so that we can analyze where do you stand if you want to sit in this exam, how much preparation do you need, and then you can of course contact us for furthermore free demos and guidelines as well. Test, we'll move on towards the reading subtest, and we're going to solve only part A of the reading subtest, where there are 4 texts given, because we don't have enough time over here in this video and it's only going to be an overview. So let's quickly move towards the reading part. This worksheet, the topic is written on the top. It's the paracetamol overdose. We're going to read the question that for each question 1 to 7 we need to decide which text A, B, C or D mentioned in the text boxes below the information comes from, and you may use any letter more than once. So in which text can you find information about question number 1 is the various symptoms of patients who have taken too much paracetamol. In which text box A, B, C or D is this mentioned? The various symptoms. Now we need to look for the symptoms where there is paracetamol overdose, and what are the symptoms the patient is having when there is an overdose of the paracetamol. So we need to focus up on the symptoms. We need to find the symptoms when we go through the text boxes. The next question is the precise levels of paracetamol in the blood which require urgent intervention. So we need to look for the levels of paracetamol in the bloodstream. So these are the keywords we need to focus on when we are reading our text in the part A, and we need to do a quick skimming over here, where we need to identify that where is this information located. We need to look for the symptoms of the patients who have paracetamol overdose, and we need to look for the levels of paracetamol in the bloodstream when there is a paracetamol overdose or when an urgent intervention is required. The next thing we need to look for is the steps to be taken when treating a paracetamol overdose patient. So what are the steps, what are the treatment options given, or what steps are we going to take when we need to treat a patient with a paracetamol overdose? These 3 things are the key points where we need to look for the answers while reading the text. So let's find these answers now. The heading is contraindications and interactions of paracetamol, but we need to look for the symptoms and we need to look for the steps taken of how to treat the patient with paracetamol overdose, and we need to look for the blood levels of paracetamol in order to find our answer. So it's least likely that we will find our answer over here, but let's go through this part of the text very quickly. It's written that special warnings and precautions for use when analgesics are used for long-term with administration every 2 days or more frequently. Headaches may develop or increase. Headaches induced by overuse analgesics. In such cases, analgesics should be discontinued. In the next para, certain care is advised. Other contraindications are shock and acute inflammation due to hep C virus. The hazards of overdose are greater. Blah blah blah. And then in the next section, it's written interactions with other medicinal products, and we have a list of drugs over here. We have anticoagulants. We need to look for the domperidone, the imitinab, and in the next para it's also written about the total of 169 drugs. And all of this whole paragraph, the whole text A, is of no use for us in the 3 questions we just looked for. So I don't think that we have the answer here. So let's quickly move towards the text box B. It is very clearly drawn a flow chart over here which is telling the acute what are the procedures for acute single overdose. That means what are the steps going to be followed when you receive a patient with a single overdose of paracetamol. You need to establish the time since the ingestion of paracetamol was given. Was it less than 4 hours? Was it more than 4 hours? And then what steps are you going to take? So we have our one answer over here, that the steps to treat the patient. I think it was question number 3. So the answer to question 3 will be text box B. So we can see this very quickly over here, and we do not need to go through every detail or read that what are the steps we are going to take. We are not bound to answer what steps are we going to take, but we are just going to tell that in which section is the steps to treat the patient with a paracetamol overdose has been discussed, and we got our answer here that it's B for answer 3. emergency treatment of poisoning. So you might get confused regarding the steps to treat the patient over here, that we just decided that we're going to select B, text box B for that, but over here it's also written emergency treatment for poisoning. So let's see, do they have the steps like they have in text box B or not. Over here it's written that patients whose plasma paracetamol concentrations are above the normal treatment line should be treated with acetylcysteine by IV infusion. So over here we have the plasma concentration of the paracetamol overdose, and we have a graph mentioning the paracetamol concentration in the plasma in millimoles per liter and in mg per liter, and there's a whole graph plotted over here which is predicting that where is the paracetamol overdose going in the bloodstream, in the plasma concentration. And this was our second question, in which we wanted to know that what are the plasma concentrations in the bloodstream and when do we need to take the action to treat this. So we have both the things here, the emergency treatment actions over here for paracetamol poisoning, and also the plasma or the blood paracetamol levels are mentioned over here. So we have our answer for question number 2, which is text C. So we're going to write text C in the answer for question number 2. The first question was regarding the symptoms that a patient faces when they go through a paracetamol overdose, and we did not go through the symptoms in text box A, which was about contraindications and interactions. In text box B we had steps for treatment. In text box C we had plasma concentrations, and now we have only text box D left, where we'll have to go and we need to find out the symptoms over here. So if we go through this text over here, right here it is written that clinical assessment, it is written that commonly patients who have taken a paracetamol overdose are asymptomatic. So if they're talking about asymptomatic, that means they will mention the symptoms as well. So they're asymptomatic for the rest of the 24 hours or just have nausea and vomiting. But if they have hepatic necrosis and they have right upper quadrant pain, jaundice, it develops after 24 hours. It can progress to acute liver failure as well, and the patients may develop encephalopathy, renal failure, oliguria, hypoglycemia, lactic acidosis. These are all the symptoms, and this is where our answer lies. So in the answer for the question number 1 would be text box B, because all the symptoms are mentioned over here which were not mentioned in any of the other text boxes. We're quickly going to mark our answer for the question number 1 for our reading task. There's two questions 1, 2 and 3. For 1 we chose the text box D, for 2 we had text box C, and for 3 we had text box B. Now moving on to the further questions 8 to 13. We need to answer each of the questions 8 to 13 with a word or short phrase from one of the text. Each answer may include words, numbers or both. So these are very small. You don't need to write the whole sentences or whole stories over here. We just need to mention it in only a few words, numbers or both. So the question is, question number 8 is, if paracetamol is used as long-term painkiller, what symptoms may get worse? So now we know that where are the symptoms located, and we need to look that what symptoms may get worse if the time duration has been increased for the paracetamol overdose. So going back to where we found the symptoms, we found the symptoms in text box D. We're going to go back to the text box D and we're going to see that what symptoms may get worse. That's all we need to look for. In question number 9, it's written, it may be dangerous to administer paracetamol to a patient with which viral condition. So we need to look for a viral condition in which the paracetamol gets dangerous for the patients, and that might be also mentioned in text box D or maybe in text box A, but we know that in text box B the steps were mentioned that when do you have to treat the patient with the paracetamol overdose. So we are not going to go back into text box B, and we remember that in text box C we had the plasma concentration of the paracetamol overdose. So even in text box C we are not going to find the answer. So it's either going to be in text box A or it's going to be in text box D. So we're quickly going to go through only these two text boxes. The next question is, what condition may develop in an overdose patient whose who presents with jaundice. So now we need to look for the word jaundice, and jaundice is a symptom. So the symptoms were present in the text box D, as far as I remember. So we're quickly going to go through the text box D again, and we might find a lot of answers in that text box A or in text box D, and we don't have to go through the text box B and C for all the 3 questions over here. So let's quickly go through the text boxes again. It's A again over here, and it's written in the very first line of the very first paragraph that where analgesics are used long term with administration over 2 days or more frequently, headache may develop or increase. Headache induced by overuse of analgesics should not be treated by dose increase, and in such cases the use of analgesics should be discontinued in consultation with the doctor. So we have our time duration increased over here, that in paracetamol overdose, if the time duration is increased, if the analgesics are used for long term for more than 3 months, it causes headache. And this is what our answer for question number 8 was. So you can write down headache and you can notice this down. So we got our answer in the text box A, but we do not need to mention that it's the text box A. We need to mention in one word. So we're going to write down headache as our answer over here. Then let's go through the rest of the paragraph as well. We might find our the other answers over here as well. In the next paragraph, it's written, care is advised in the administration of paracetamol to patients with alcohol dependency, severe renal hepatic impairment. Other contraindications are shock and acute inflammation of liver due to hepatitis C virus. Now when you read the word virus, you quickly recall that it was in your question that which virus affects the patients. And over here we have our answer. It's written, the answer is not shock, the answer is not acute inflammation of liver, because it's not the virus, this is not the viral disease, but it's due to hepatitis C virus, which is a viral disease, and this is our answer. So hep C virus or HCV or hepatitis C virus, this is our answer for the next question we were looking for, and we got the second answer. Now we're only left with the last question. Text D again. In the second bullet point, it's written hepatic necrosis, elevated transaminases, right upper quadrant pain, and jaundice. Now jaundice is the key word we were looking for, which was mentioned in our question, that in which condition the jaundice occurs. So the condition is not mentioned over here. It's written that, let's read it onwards. It's written that hepatic necrosis, right upper quadrant pain, and jaundice begins to develop after 24 hours and can progress to acute liver failure. Now we got the condition over here, which is acute liver failure, that jaundice and other symptoms can progress into acute liver failure after 24 hours. So in one word answer, we have our answer of acute liver failure, which was the answer we were looking for the last question. And I think we're done with all of the question answerings in the reading section. So let's go through all the answers quickly. The answers to our reading subtest, you all did really well. I can assure you. Do not forget to mention how much you scored in your listening, how much you scored in your reading in the comment section below, and let me know so that I can assess that are you ready for your OET exam, or do you need to take any more classes. And it's always better to have a supervisor who can tell you where you're making your mistakes and where do you think you're having any confusions in your subtest. So do mention down your scores below so that we can have a look at the assessment and move forward with the further subtest. The writing subtest, in which we have to write just one letter, which is usually a referral letter to either a doctor, a consultant, a receiving doctor, an admitting doctor, or a nurse or a dietitian, whichever the profession you are choosing for. It is occupation specific, as I told you before. And some other types of letters could be either discharge letter or a transfer letter. We even have advice letters or urgent referral letters as well, or urgent admission letters as well. So there are many types of letters that can come into your task to write the letter. And if you take our subscription, we're going to teach you all types of letter writing, which includes 12 classes in total, and there are going to be 3 classes in a week where we're going to focus on your areas at which which you're pretty much weak, and we're going to prepare you to sit in the final exam of OET with confidence. So the contact information is written in the description below. Do check it out and check if you need the requirement, and you maybe get our supervision and clear your OET in the very first attempt. I have a case note. This is how the original paper looks like. This is for the subtest medicine. This is for the doctors only, but for nursing and for other professions, it is very much similar to the case note. Sometimes even the cases are similar as well, and the nurses have to refer it to the nurses only, and the doctors have to refer it to the other doctors only, and the entire case notes are the entirely same. So do not worry regarding the subtest type, whether it's medicine or it's for nurses or other professions. You can pause the video or you can have a look at it thoroughly. I hope it's pretty much clear. I'll attach a link to it as well in the description box, and let's move forward then. Here we have a very basic letter writing format. You all know that we are going to start it with the address, and on the top of the address will have the name of the person we are referring it to. Could be the admitting doctor, could be a receiving nurse, or whatever it is mentioned in your writing task. Then you're going to mention the date, you're going to mention the greeting. Then there is an RE line in which you're going to mention the patient's name and the patient's age or the date of birth. Then we have the whole body paragraphs, in which we have the introduction, the middle paragraphs, and the final paragraphs, where all these three paragraphs, everything should be very much clear that what the patient has and what needs to be done further, and all the details are into these three paragraphs, which we are going to teach you if you're going to subscribe to our packages. Then we have the ending over here, that you're going to write your sincerely, and then the job title. Job title is going to be nurse for the nurses, it's going to be doctors for the doctors, and for whatever the profession is, the job title is going to be the same as your occupation. Next up is the speaking test, which is the last subtest you're going to give in your OET exam. You will be providing 2 speaking role play cards, and before starting with the role play cards, there is going to be a short warm-up conversation about your professional background with your speaker. This part of this warm-up conversation is not recorded or not scored, because it's just so that you get comfortable with your speaker. You should know what type of accent they are using. Are you clear with their voice recognition? Are they clear with your voice recognition and you're having no issues with it? So you need to be assured that you are comfortable during this warm-up conversation, and you do not need to focus on the answers, that what you are going to answer when quickly when they're going to ask you regarding your professional background. They're mainly going to ask that why did you choose this background, and what is the good part about this profession, or what is the bad part about this profession? How do you feel while choosing this profession? After the warm-up conversation, the role play cards are introduced one by one, and you have 3 minutes to prepare for each role play card. That means that you can mark on your role play cards, you can underline, you can circle, or you can make any types of markings, and there is no restriction to it. And then after the 3 minutes, you must be speaking for about 5 minutes in each role play card. The basic time frame is for more than 4 minutes and within 5 minutes. That is the perfect time frame, and you need to practice with a very good expert speaking partner for this area. And we're going to have speaking sessions very soon, so you should follow and subscribe to our packages, and the details are provided in the description box, and keep updated on our WhatsApp group as well. So in the 5 minutes, the role play cards are going to explain the situation in which you are required to do so. So you're going to be the doctor, and the speaker is going to be the patient, and they're going to describe their condition, and you're going to counsel them accordingly as the tasks are written down in the bullet points right on your role play card. Let's have a look at one of the role play cards, shall we? Play card, this is for the doctors. The setting is a suburban general practice, and we have a 45-year-old patient who is attending the practice after suffering a mild anterior myocardial infarction 2 weeks ago. Recovery was uncomplicated and the patient was discharged from the hospital 4 days ago, and he is now very concerned about the long-term process of recovery. So the task over here is written down in the bullet points below. You need to find out what is worrying the patient and you need to reassure him. So the patient is a 45-year-old patient who had an MI 2 weeks ago and he was discharged 4 days ago, and now he wants to know about his process lifelong recovery. So you need to reassure the patient after knowing what is worrying him. On the other hand, the patient, the speaker will be acting as the patient, and they will have their own role play card, and which the task will be provided that they need to show their worry some according to regarding their recovery process in the long run. So you need to reassure them according to it. They are going to mention some fatigue, as it's mentioned over here that some fatigue is to be expected. Usually takes some time, some weeks before the full energy levels return. So you need to rephrase all of these in your own words, and you need to reassure the patient that it's going to take time, but you're going to be okay. The next task is advise the patient of the importance of joining the cardiac rehabilitation program at a nearby hospital in order to increase exercise tolerance under supervision. So you need to counsel the patient about the exercise. You're going to counsel the patient regarding the rehabilitation cardiac program taking place in a hospital, and you're going to just pretend some fake information and tell them there's a program, rehabilitation program going on in a nearby hospital, ABC hospital, or whatsoever you want to say. You can name any kind of hospital over here. There's no restriction. You can totally pretend like there is a hospital, a New York hospital, or general hospital nearby where this cardiac rehabilitation program is taken. You should participate in it for a better recovery option. Then the next task is explain the importance of exercise. That means that if you exercise daily on your basis in early in the morning or in the evening, it's going to lower your cholesterol levels. It's going to lose your weight, and it's going to strengthen your heart so that you don't have another attack next time. This is how you're going to reassure your patient, and you're going to counsel them and convince them to exercise daily. And the patient should have your whole concentration, and the patient should be listening to you, and you should have the confidence in your patient that you are dealing correctly with your patient. So this is very much important, and we're going to make you practice when you're going to have a one-on-one conversation with me directly in your demo test. If you want to subscribe, you can definitely have a free demo test, and you can see how we're going to assess and how we're going to make you practice for the speaking test. And you need to have a very good speaking partner or an OET expert instructor who can guide you, who can make you improvements, who can help you be perfect in your speaking subtest. We're going to sit for your final OET exam. So this is how you're going to fulfill your task in more than 4 minutes. You do not need to be very quick at completing your task, and you do not need to be very slow so that the time range is more than 5 minutes, and that's going to be a bad point for you. So you need to set a timer in front of you to 5 minutes, and you need to start speaking, and you need to have a good speaking partner for that, and you need to see how much have you done in your 5 minutes. Have you fulfilled all the tasks, or have you missed out some points? And you need to have a good speaking partner who can point out that you missed this point, you did not deal with this point very effectively, very efficiently, etc., etc. And there are a list of points you need to improve and look for when you're dealing with the speaking subtest. So let's move on then. At the patient's role play card, but this is how it is. You can pause the video and you can see what is going to be mentioned in the task of your patient, and how are they going to react towards you, and how are you going to deal with their reaction, and how are you going to counsel them, how are you going to reassure them. You will have specific dialogues when you need to speak for each and every type of reassurance, counseling, reference, advice, anything. You have to to practice that a lot, depending on how much fluency you have, how much confidence you have while you're speaking, and that you're not having a lot of breaks in your speaking. So there are a lot of things that, and I think only practice can practice with an OET expert, or practice with a really really good speaking partner is going to help you out. So do look forward to it, and we'll move forward to that. We're finally done with our all 4 subtests of the OET. We're done with the listening, we're done with the reading, we're done with the writing part, and we're done with the speaking part as well. I hope everything is clear to you all so far. You can always drop in your comments wherever you feel like you were confused or you need any sort of help. I'll always be there to guide you wherever I can. You can contact me on the WhatsApp group for any kind of general information. I'll totally guide you for free. And if you feel the need for subscribing, feel free to contact us. The details are in the description box below, and you can definitely drop down your comments, and you can have a discussion, or you can ask me a question for any sort of clarifications. So I'll be looking forward to your comments, and I'll be reacting to them. Through the summary of today's class, shall we? So first we started with the introduction to OET, that who can take the OET and for what purposes OET is considered worldwide in many countries. Then we discussed about the professions available for OET. So there are 12 professions, and you need to choose wisely in what profession do you fit in. If you're a dietitian, you cannot sit for the medicine subtest, or if you're an occupational therapist, you cannot sit for nursing OET. You need to choose your profession very wisely over here. Then next on, we discussed we had a detailed description about the OET subtest. It's also in the written form, that how much time and how much scoring it is in each and every subtest. And we also demonstrated that. Further, we made the short practice test over here. They're very short and very detailed, explained. I told you how the entire OET subtests are going to come in the final exam, and how you're going to deal with, how you're going to answer them, so that it's going to be convenient for you all when you are going to sit for a free demo class under our subscription. You can contact us in the description box below for a free demo, and we're going to set up your free demo, and we're going to assess you. How much requirements do you need, or are you ready, or you just need a little bit of supervision, and where you are weak and where do you not need to practice a lot. So do have a look, and do take our demo test that's going to assess you. At the end, I'd like to thank you all for joining our today's class. Do not forget to like this video if this was helpful to you in any way. Subscribe to my channel for further videos, and you can share this video. You can comment down your scores in the description box below, and I'll contact you, and I'm going to reply to you very soon on your comment section, in the comment section. And you can discuss, you can ask me questions, anything you feel like asking me. I'll be there to guide you regarding it. That's all for today, and let's see you in the next video.